The healthcare workforce crisis requires innovative thinking that bridges the gap between education and industry. Today, we're exploring how strategic partnerships between educational institutions and healthcare organizations are creating pathways to the future of medicine. I'm joined by Geoffrey Roche, the first director of workforce development for Siemens Healthcare North America, who's pioneering new approaches to building a sustainable healthcare workforce. Geoffrey, thanks so much for joining the podcast.
Thanks, Ray, for having me. Good to be here.
So you're the first, the first director of workforce development for Siemens Healthcare North America, massive organization. So you're essentially building the plane as you fly. You're writing the playbook for this role, or you're kind of putting your feet in the wet cement. What data points, what insights have shaped your approach to this idea of building a sustainable healthcare workforce?
I started my career in hospital administration, spent a decade in the hospital administration space, and then actually served in academia, two different academic institutions. And so I've had, sort of the privilege of leading and engaged in workforce development and workforce transformation on the hospital side, and then also had the privilege of leading strategy and strategic partnerships on the academic side in partnering with industry to solve workforce related issues. And so when I was asked to consider coming on to Siemens to lead this inaugural role, obviously I brought that experience with me. So the first thing I had the privilege to do is to collaborate across our global organization to really establish and then implement what is a globally approved healthcare workforce development ecosystem. That was super critical because obviously in a large global organization like Siemens, you want to make sure you have alignment within a matrix type of environment so that as you work on initiatives, you have alignment from business function to business function. And so that was the first thing. And obviously, I did that with an incredible team and other leaders within the first couple months that I was here. And then, really, after that, the key was really beginning to look at all the different opportunities and challenges that exist among our customers, which are obviously hospitals and healthcare systems, and then consider how you leverage that ecosystem from K through 12 to higher ed to community-based organizations to government to workforce boards to philanthropic and the venture capital space to really solve this issue. And this is a global issue. It's not just a US issue, but it's global. While I am focused on US and Canada, there is also no leader in my role that functions globally. And so I collaborate with our global organization to really ensure that as we approach this, whatever we do here can also be potentially replicated with in country some variation. But I'll tell you, from a data standpoint, our value at Siemens is listen to our customers first. And so we know what the labor market data says about healthcare. We know that, by 2028, we're expecting to have millions of jobs of individuals that will retire and leave. And then, the question is whether we have the workforce to replace them. And today the answer is no. And so we have that data set for sure. But a lot of this work really requires active intentional listening and then really looking at how we bridge and how we connect into the ecosystem to help solve it.
It is a global crisis. And it's fascinating for me as somebody who's been in higher ed for a while to see how ill-equipped many institutions truly are to address these crises. Take nursing, for example. We know we have a shortage of nurses. We can see that institutions that are innovative in creating new kinds of nursing programs are seeing demand. And yet we have large state institutions, large systems that refuse to expand the size of their nursing programs. Maybe that has to do with clinical capacity. Maybe that has to do with other issues, but they're not being innovative about it. And I think that spark you're bringing to the conversation about sort of that collaboration with hospitals, with healthcare organizations. So I'm fascinated about that. What does effective partnership there look like? What does an effective like eds and meds, I think you use that term, I love that, collaboration look like that goes beyond those traditional like clinical placements, like that issue of that the kind of Achilles heel of nursing programs with clinicals? What is an effective collaboration look like?
In many ways, what it looks like is really serving in that important role of a convener. And obviously, an organization like Siemens can be, yes, we supply and provide that, technology and equipment that enhances access to care. But at the same time, we're also wholly committed to building a future ready sustainable workforce through different educational solutions and even products. But at the end of the day, when you look at the workforce crisis, it really does come down to convening. And here's the reality. To your point, certainly there are challenges and opportunities on the academic side, but also same on the industry side. I've sat on the hospital side, and the reality of it is that many hospitals have been extremely reactive in thinking about building a future ready workforce. And so traditionally they work with an academic institution and they're just working on those clinical placements instead of actually together strategically planning on what does the future of the workforce need, and maybe even what does our existing workforce need, and harness the power of an academic institution to support those needs. And so for me, sometimes it's just a matter of being a bridge, bringing them together to more strategically ask questions to see how and why maybe we haven't thought about this versus this. The other piece I'll say is also being a thought provoker. I'll be honest, if I, as somebody who's been in this space my whole career, if there's two areas that I would highlight that have significantly been what I would consider to be challenges that have held back us really innovating in the healthcare education space, it's actually accreditors and licensing boards. There's so many examples in the healthcare space where both the accreditor and the licensing board are just not up to date with where we sit today. I mean, we're in 2025 and many licensing boards may be, having standards or board policies that kind of speak to 20 to 30 years ago still today. We regularly will also engage at that level as well, to simply be a convener as well as a connector. And because of the work that we get to do, we get to travel and learn from, almost like 9 out of every 10 hospitals. And so as we learn about those neat ideas, those best practices, we want to take them and share them with accreditors and licensing boards. So as they're thinking about an ever-changing profession, well, why is it that we've put barriers on a student earning money while they're doing a clinical experience? Frankly, think about equity, right? I mean, if you're a student, you have to choose between an academic career and a job. And depending on your family needs, you may need both. And so, we try to really think about those types of things and then share experiences of an employer that's doing some innovative work. And then hopefully, be able to move the needle.
I want to unpack a lot there, but let's start with what you just mentioned around equity. When I was a PhD student, I had a stipend that barely covered my expenses, and I took out student loans. And then when I actually had to go find a job because I needed the money, my funding was pulled because I wasn't allowed to have a job while I was a funded PhD student, which, looking back, was really detrimental to my life and my ability to gain the employment I was looking for after that credential. So the work you're doing is emphasizing equity through workforce development. And we also talked about the fact this is a global challenge. This is something that's happening not just across North America, but we have this sort of healthcare talent crisis. Talk to me about the connection between who we train, how we train them, the ability to deliver equitable healthcare across diverse communities. How does equity play into your work?
Yeah. So at Siemens, when we put together, as you heard me talk about the globally approved healthcare workforce development ecosystem, one of the facets that literally is woven into all aspects and integrated into that framework is diversity, equity, inclusion, and belonging. The reality of it is that the most effective access to care requires that we have a workforce that can actually best reflect the patients that they serve. I know that's not necessarily what we're hearing, in Washington right now. And I think all higher ed institutions are facing significant challenges around this idea that it's some type of woke agenda. Here's the reality. For anyone that's been on the front lines of healthcare, you need to have a workforce that can understand different cultures. And you need to have a workforce that can speak to those different cultures because it's not the same. And no one is suggesting that this should be, equal care, because obviously the idea of equity is that your needs are going to be met for who you are. And that ultimately, when we think about healthcare, you're going to have the opportunity to have those needs met. Why that's super critical is if you look at an issue like maternal mortality, which is unfortunately a great example where in the United States, we poll significantly lower than many other countries in this world. Even developing countries do better than us with maternal mortality, and particularly among Black and brown moms who, when they exhibit different symptoms, their needs are not necessarily heard or met and ultimately could lead to the death of the baby or the death of the mom. That's not good enough. I mean, that should not be the case in the United States. And why I bring that case up is that, you need to be able to teach on that. You need to make sure that's a foundational aspect of how we train and teach healthcare professionals. For years, we called it cultural competence, but it's so much more than that. It's frankly really understanding how you treat and meet the needs of different populations. This is an evolving space within academia, and we've had certainly an increased focus over the last several years in all aspects of healthcare professions to really emphasize the importance of this. We can't go back in time. We need to continue to move forward. You think about imaging, you think about lab, you think about radiation therapy, you think about even in the biomed field. You want to have a workforce that understands what it's like to treat all the different populations. And you want to have a workforce that's informed so that they're not looking up something, when they're actually providing that care. Then the final point I'll just make that we see also as important into this conversation is one of the reasons why we have advocated for more and more apprenticeships in the healthcare space is one way to create a more equitable workforce is to have youth apprenticeships and career pathways. Healthcare historically has been a space where you have to have a college degree. And that makes sense in clinical areas for certain. But what doesn't make sense is to have roles in healthcare, pre-licensure, for example. You don't have to have a college degree to do roles that are pre-licensure if it can expose you to ultimately then work and then earn and then actually get that college degree to then be a licensed professional. And so we have to be very thoughtful around this because how do you build a future ready, sustainable workforce on a model where a student thinks the only entry point is a bachelor's degree or an associate's degree? That cannot be the view, and it should not be the view. And I regularly have said healthcare in some ways has kind of shot ourselves in the foot on this issue because we haven't necessarily been willing to change that. Now, the good news is we're seeing good movement there, but we have a lot more work to do.
Institutions are grappling with these very issues right now. You see the value of any kind of degree being questioned. You see the scramble around potential changes to diversity, equity, inclusion, belonging, and access affecting how institutions operate. Even recently, conversations around changes at the National Institutes of Health have led schools such as University of Pennsylvania, which announced, I believe, last week that they were suspending admission for PhD students, which is going to have a tremendous impact. So the institutions are dealing with all of these challenges, these misalignments, these gaps. What are you seeing now that maybe the institutions are not seeing? What might help feed that educational pipeline better that institutions may be missing the mark on right now?
We have to do a lot more work to attract individuals into the profession, and that has to start earlier. And so I'm certainly encouraged by what, in the last year has been a very, very intentional increased focus within both a national level and then at a state level around how do you have more healthcare connected high schools or more healthcare connected middle schools. We've got to do more of that work. And obviously, Bloomberg Philanthropies is a good example where they're bringing together high schools, community colleges, healthcare systems, and others, and even four-year programs at times to really think about this. The other piece that has me encouraged is you've got states like Wisconsin, where, Wisconsin, has done a phenomenal job of really building and rolling out a healthcare apprenticeship type of model that was actually employer driven, employer led. And, certainly because of that employer led and employer driven approach, they've been able to get community colleges on board and University of Wisconsin Health, UW Health, has launched, two of the first ever apprenticeship degree programs in the United States, one in nursing and one in respiratory therapy with a tech college. That's innovation. In both of those examples, there were changes that needed to be considered on the accreditor end, and they were successful because the employer led the way and showed the accreditor that they could safely and appropriately ensure that there wouldn't be any impact to both the quality of the education and the quality of the clinical experience, and then ultimately that it would actually be a value add to the overall program. We've got to have more innovation from that space too. I have regularly said that in the healthcare system space, it is not fair to point to higher ed and say, this is your job to fix. This is all of our jobs to fix. The best places and best practices that I've seen is literally where the C-suite of both organizations are regularly and routinely meeting. In some cases, some of the best practices have actually been Give an executive at the college a role at the healthcare system, and give an executive at the healthcare system a role at the college, and have them report to the CEO or the president on both levels, and have them work aggressively to fully integrate. I'm not suggesting merger and that type of thing, but what I'm suggesting is an integrated model. If you serve in a region at a college where healthcare is one of your top three employers, then how integrated are you in understanding those workforce needs and literally coming back every day and thinking about how you solve them? There's great models that I've seen in the country where that's the case. And certainly Siemens plays a role at times in bringing them together. So when we go on site, we ask these questions. And obviously, because of the role we can play, there's just different things that we can suggest. We've also really tried to elevate these conversations, even with the National Governors Association. So we've done a lot of webinars and those types of things. We're regularly asked to speak at the larger events, the US Chamber and Holland IQ and many others, so that these types of conversations are happening. And they're not just a higher ed focused conversation, they're a holistically eds and meds conversation. Ultimately, our vision and goal is you've got to have, a workforce that can treat the needs of the patients, and ultimately think about it from a Siemens perspective, right? We can make the best technology, but if there's not the care team to utilize that technology, then that access to care doesn't happen.
And I think you're seeing more of those kinds of convening organizations, whether they're private companies, whether they're governmental entities. I mean, on this podcast, we've had interviews with Instride and Guild that have brought world-class healthcare programs in education together with the needs of companies that are serving patients and need to either upskill, reskill, innovate, grow, expand a workforce. And it's great to have ecosystems like what you mentioned in Wisconsin, where not only do you have world-class education, but you have some of the most innovative healthcare organizations. Switching tracks a little bit, as technology like artificial intelligence becomes more a part of the delivery of quality healthcare, I think everyone agrees that the human has to be involved somewhere. So I'm just curious to hear your perspective on preparing the workforce for a future where there is a need for that technical expertise, and yet most folks are in the business of patient care, that compassion, that human element has to coexist with the use of technology. Just curious to hear your thoughts
Mhm.
on preparing the workforce for that.
Yeah, I can't agree more. Look, I mean, the reality of it is that healthcare has had AI in so much of it for many years, particularly at the medical device level. And I think what we've learned in healthcare is when we rely too much on technology, we often miss the human side of what healthcare is. So while we need to use the technology to make our healthcare system better, and we need to use technology to make our healthcare experience for our workforce better, we do not need to use the technology in a way that actually inhibits or impacts patient care. At the end of the day, we can study over the last several years and we will see that employee engagement has suffered and gone down significantly, and so has patient engagement. There's simple answers to that. We haven't necessarily prioritized the well being of our team members, nor have we prioritized the communication, empathy, compassion, and such with our patients. That's the responsibility of leadership. At the end of the day, it's the responsibility of leadership because we're dealing with a workforce crisis. So that means the workforce is doing a lot more with less. For those of us that have been at a doctor's appointment, we see it, right? They've got to click, 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 click to get to your medical record. They've got to see a number of patients within a 15-minute window, sessions throughout the day. At the end of the day, we're taking out the humanity of healthcare. There's some incredible work occurring in this space. In fact, for those that don't know, the Gold Foundation is an amazing organization that works with academia and healthcare systems and organizations like Siemens to remind us, and actually rolls out curriculum and educational resources on how to really make sure we're always bringing humanity into medicine, bringing humanity into nursing, bringing humanity into all aspects of healthcare. I can't highlight enough how important this is. And I'll say, even at Siemens, we have continued to have a very strong emphasis on this. If there's one thing that healthcare has always been about, it's the power of stories. But you can't tell those stories if you don't focus on the humanity. And so ultimately, while we have AI and we have all these new elements, we've got to always remind a future healthcare professional that the most important thing that they can do at all times is to impact the lives of each and every patient and family member through conversation, through service, through how they treat them. That is what will be remembered. It's not the technology that will be remembered.
It's about that patient engagement, their interactions. We didn't even talk about medical billing and that whole side of the equation that has nothing to do with the care, but it has to do with how they feel about it and have to deal with it afterwards and may not even get the care. So there's a lot swirling here, and maybe we can sum this up. You're part of a organization that has incredible convening power, and we've kind of touched on that several times. The idea that there have to be ways to bring higher education institutions together with healthcare organizations to innovate, to address where industry is headed. If you were advising a graduate program right now, nursing, or we could use nursing as an example if you'd like, to prepare leaders, what would you tell them to start doing differently to align with where you see industry is headed?
Yeah, I would flip that question, right? Because I think ultimately the one challenge we've had in healthcare is we're waiting too long until like a graduate or already when they're a leader. We actually have to embed the idea of what it's like to lead with empathy, what it's like to lead through active and intentional listening, what it's like to lead with a culture that actually empowers, encourages, supports, appreciates, and values the workforce much earlier. In fact, I would suggest that that has to be actually a core aspect in every healthcare program, whether it's at the allied health level, the nursing level, associates, bachelors, etc. And the reason of that is because oftentimes in nursing, even in imaging, in a lot of our healthcare spaces, you get promoted into leadership role well before you may even have a graduate degree. The more that we do to at least kind of wet the whistle and introduce people with the idea of these things, the better that we're going to have them be prepared when they get that leadership role. You think about succession planning in healthcare, it's a space that we don't do very well at. And one of the reasons is because we tend to be focused a little too much at a higher level. Where we actually want to be focused is earlier in that journey, creating future leaders so that when they get into middle management, they're best prepared for the next levels and so on. And so we have a lot of work to do in this space. And I can't highlight enough. Look at like Siemens, for example. Siemens rolled out a leadership development program that we partner with hospitals on, and it's in the imaging space. And we've had great results, particularly to grow imaging professionals into future leaders in imaging. Obviously, we've done that through what we know is required within that space: change management, the idea of investing in your people. And, we've had great results with over 90% of hundreds of individuals now that have gone through that being promoted. Over 93% of them have been promoted within their existing healthcare system. This is a space where I think, again, which I think to your question, it's an amazing space for higher ed and healthcare to come together. Higher ed should be an academy for healthcare when it comes to leadership development, when it comes to professional development. And I often find that we just haven't brought them together in the way that I think when they can be, it can be really sustainable and successful.
Well, we're looking forward to seeing more and more of that happen and appreciate everything you're doing. Geoffrey Roche, Director of Workforce Development for Siemens Healthcare North America. Thanks for sharing your insights.
You're so welcome. Thanks for having me.
So here's my take. The intersection of healthcare and education is fascinating. It's where some of the most exciting innovations are happening right now. Over my work, I've come to realize that workforce development has evolved from something that used to be sort of a back office HR function to a strategic leadership imperative, and it's shaping the future of industries like healthcare and specifically patient care. As healthcare faces unprecedented staffing challenges, the collaboration between educational institutions and medical organizations isn't just beneficial, it's essential for not just their survival, but our survival. Many institutions, frankly, are not agile enough to address this crisis, it seems. And Geoffrey's pioneering work at Siemens Healthcare gives us a front row seat to how this transformation can really work.